Hello and welcome to another exciting episode of HealthAfrik on AAU TV. I am happy to have you joining us today as we celebrate our fathers and also dive into a topic that is often overlooked, and that is posture. You know, our fathers always find themselves in demanding roles, the long hours at the desk, heavy lifting, and also the daily physicality that often comes with parenting, and their posture is challenged. And today we'll be exploring how the posture affects or impact on their physical health, their even sexual health, as well as their confidence. Yes, I know when we talk about posture, we only look at how we stand and sit, but then the implications goes much deeper. Remember, this program is brought to you by the Association of African Universities, AAU, and my name is Isabella Teta-Henakwa. We'll go for a break. When we come back, I'll introduce our guest to you and start with the discussion. Please stay tuned.
African Universities Television, AUTV. I just want to say that without the media, you won't know what's going on in the world. Even with the media, you sometimes don't know what's going on in the world. So you need to tune in to the reliable sources who are really on the front lines, who can give you the information you need and give you facts, not conjecture, give you real news, not fake news. And this is the place to find it, AUTV.
The voice of higher education in Africa.
You're welcome back from the break, and this is HealthAfrik on AAU TV. As I said, today we are celebrating our fathers, and we are going to discuss on the topic posture. It's not just posture, but also the impact on their physical health, their confidence, fatherhood, as well as their sexual health. And I'm happy to have here with us Mr. Samuel Ayim Aboah, a principal physical therapist from Nuffield Clinic. He's going to share with us how we can recognize bad posture and also share with us some tips to improve our posture. Hello, Mr. Samuel.
Hi.
You're welcome to HealthAfrik.
Thank you.
Today we are talking about posture,
Okay.
but before that, I'll be happy if you can briefly tell us more about yourself.
Okay, thank you very much for inviting me to this program. My name is Samuel Ayim Aboah, as you've rightly mentioned, and I'm a trained physical therapist from the Netherlands, and I've been working in Ghana from 2012.
Okay.
Yeah, then I returned, and I'm happy to be with you to share our knowledge on posture as we celebrate this month our fathers, or male gender, as you know. So I take this opportunity to wish all fathers a happy Father's Day in advance, and we hope that by the end of this program you really have something important to take home.
Great. All right, and once again, thank you for joining us today. I'll take the opportunity to wish you in advance Happy Father's Day.
Thank you.
Right. Doc, today we are talking about posture. When we say posture, we are looking at how we hold our bodies, when we talk, when we walk, how we sit, and also how we move. But then, being an expert, tell us the science behind posture and also its impact on our bodies.
Okay. Thank you very much. Yes. To our dear viewers, I welcome you to this program. Yes, I'm coming from Nuffield Clinic, which we are located at Osu Sunka Street. Yeah. We deal with orthopedic conditions and then general medicine. So in case of any problem, please come to us. I would like to also take this opportunity to really wish our fathers a very happy Father's Day in advance, which comes off this Sunday. Yeah. Okay, yes. Okay, yes, very good. As you said, posture is very important topic that usually we do ignore it in our medical practice, okay, or in general at home. Whatever we do, we put our body into a position that either it helps us or either it hurts us. Yes, posture simply refers to how the body is put into doing certain activities, okay. It's the alignment of a correct way of aligning your body. Okay, if you are either sitting, standing, or walking, or lying. Okay, so that at the end of it, you won't hurt the body. Yeah. So in simplest terms, you can refer posture to being like that.
Okay, so you made mention it's either good, or I heard good or bad. I know when we talk about the types of posture, there are a lot, but they are classified into good or bad. Now, tell us what is a good posture and what is a bad posture. Like you made mention, aligning the body when we lie or sit and all that. And also, I know that it involves the bones, the muscles, as well as the joints. Now, with the bad and good, just give us the difference. Yeah.
Well, when actually we'll say that posture, there's not just one way posture that we want everybody to assume.
Okay.
Okay, yes. But naturally, God created the body in a way that if you are talking from the spine, from our head, base of the head, towards to our sacrum or the coccyx, okay, the spine itself, there are certain curvatures that really shows that this person have a normal
Posture.
correct posture. Okay, yes. You see, if you look at the back of the head, you will see that your neck, actually there is a mild hollow.
Okay.
Okay, then you move down to what you call the thoracic region, then you see this a bit of a rounded
Curved,
shape.
yeah.
Yes. You come down towards the lumbar region, then you meet another hollow a bit, and they go into the sacrum and the coccyx. That's where you also come back like a rounded.
Okay.
Yes. So these are naturally the way God made the body.
Okay.
Okay, yes. As we said, posture is not only involve the muscles and joints or the bones, but rather it's our cognitive, the environment play part in positioning your body. Okay, like if you come to work and you first you go to your desk, you have your PC on your table, your chair. How is it? Is it in a correct way that when you sit, you don't exert unnecessary pressure to the body? Okay, so
Very
all
true.
posture has effect, but in a good way that we want everybody to assume that the curvatures that you were born with, and we try to be in that, maintain that thing. So we call what you call an ideal posture. So when you stand and a line is drawn either on sideways through the lobe of your ear up to the ankle, that line should pass in front of the whole of the ear, the shoulder, coming down your hips or the pelvic, down the knee and the ankle.
Yeah.
Yeah. So when this line deviates, then it tells you that your
That's
posture
bad.
is a bit, yes, bad.
Okay. Now you made mention when we come from home, we come to sit down and we don't know whether the laptop is even positioned in a way that is going to even affect our posture. Now share with us some of the common daily things that we do that contribute to bad posture. I know the way we sit,
Yes.
we don't consider that at all.
Yes.
Yeah.
You know, I will start here commonly like everybody sits.
Yeah.
Right? Yes. So how do we sit in a way that we are sitting comfortably? You see, like, but let me clear the minds of many people thinking that the posture is somehow to stand or sit in a rigid position. No, that is actually not so. In the good position of the body, you must feel relaxed.
Okay.
Okay, yes. Then you can do whatever comfortable you want to do. So when you are sitting, we want you to have your neck it's in parallel with or standing in parallel with the ground. Okay, your neck position. Okay.
Okay.
And then your shoulders are relaxed. Okay. Your back, if you are sitting and the backrest of the chair, that your back should fill it up.
Should fill it up.
Yes.
Okay.
Okay, just like the way I'm sitting rightly. Your hip and the knee should flex at angle of 90 degrees. Okay, and your feet, both feet, really flat on the floor or the ground.
Okay.
Okay.
So let me try.
So, yes, that's very good.
Okay.
Yes. So now that's the way. Yeah, you are
Okay.
sitting.
Yeah.
Okay. Very good. And you're relaxing. So if supposing like this your part that you are using now. Okay. Because of the way you are sitting, if you want, you have to have something like a cushion or a foam or a stand on your lap,
Okay.
so that you rest on it. So whatever you are doing, you are not H2, you don't put your neck into poor posture to bending it, looking down this way. That is very bad. Okay, we should make sure that the screen of the gadget you're using or the laptop should be in line with your eye level.
Okay. Okay.
Yes.
Interesting.
Yes. You see, when we are talking much in terms of, let's go to the way our neck affects on poor posture to our neck, okay, or the body, starting from usually the commonest thing we do, everybody use this mobile phone, right? Yes. You see people just like this, they bend down, they're looking on this all the time. You can take hours, you can take me either lying down the same way, okay. When we keep on doing this, we stretch, we put pressure on certain muscles of the neck, especially if I measure one of the muscles, the trapezius muscle. Okay, that's run from back of neck here to the scapula. Okay. When you do the later one, it becomes very tired and it overreacts to contract at the muscle. Then it draws the shoulders into rounded posture. Okay, yes. When we assume this way, okay, you will see that your ribs or your inside here is inside the lungs also. So and then the sternum, this bone here, it push it in. So it will not allow your lungs to expand. So they can breathe well. Okay, so these are what we keep doing wrongly, and with time, it gives you problems, upper respiratory, chest problems. Okay. Yes. So it's very important that we try to avoid, when we are doing something, we put our body into a good positioning that will, at the end of it, will not hurt us. Okay.
Right, very true. Now you've shared with us some of the common things we do that obviously we don't consider is impacting our posture. Let's look at aging. You know, when we look the men, today we are talking about our fathers, the male. When we consider height, especially the tall people, as they are growing, we see that their posture, like their body, actually, they kind of exactly the structure. You see them like this. So let's share with us how aging also impacts on posture.
Yes, thank you very much. Yes, as I initially said, I did talk about the spine, the curvature, the natural curvature of our spine, okay, or the vertebral bones at the back. Okay, yes. So with aging, usually, and assuming bad posture, so with aging, some of these structures, what we call degenerating. So with poor posture, it really quickens the degenerative process that our body goes through. See, yes. So when you are aging, you reach a point and you are not careful about your posture, and you assume bad posture, you really fasten or hasten the process of degeneration of your disc or the vertebral bones. Okay, yeah. And when this reaches a point that you assume this bad posture, and later on you start to complain of back pains or neck pains. So when you notice this, it's best to actually go to a specialist to really work on your posture for you.
Okay. Yes, now let's look at posture and confidence, especially in men. You know, as ladies, it's nice sometimes when a guy walks in with their chest broad and, like, you know,
stout and really
exactly. So that is it true that our posture, our appearance actually, I mean, have some, especially with the men, have some impact on their confidence? And if so, how then should they, if they are coming in an office or even if they are walking, how should they be postured in a way that should also portray confidence?
Okay, very interesting question. And that's very, that is true. What I want to say is very, very true. It's one of the advantages of posture, correct posture, right? Yes, it really boosts our confidence and power. And I will tell you that it's this reason that the military, military really took this as part of, so that they gave training to their military officers, posture training, so that but only that they do it excessively.
Okay.
So when you see that the posture, a military person, the chest will go more out, which is excessively. right? The correct posture, you shouldn't let the chest go too much forward,
Yeah.
okay, or out. Yes. So when you stand out, right, okay, in a relaxed manner, it increases even your height. Okay, yes, it increases your height.
Okay.
Okay, and you could see that when, especially when you are in a sober mood, okay,
Yeah.
or you are down, even you compare to animals, you could see if you take a dog or a monkey, when they are not in a happy mood or they want to do something that they are very submissive, they coil themselves a bit like
Yeah.
this.
Yeah.
Okay,
Yeah.
yeah. But if you are happy in the mood and you chest out where you position yourself well, actually you boost your confidence. Like studies have even shown that with correct posture, it really increases or decreases it increases our men's hormone that we call it testosterone.
Okay.
Okay, yes.
Okay.
And then also decreases the production of stress hormone like cortisol.
Okay.
Okay, so with this, if it really will let you decrease your stress level and improve your joy and happiness, then it makes you really confident in whatever you're doing. So posture is very important. That boosts men's really morale, I would say, and their power
Yeah.
to really, yes.
Yeah, indeed, this is very important. You made mention of two things that are quite very interesting. One, there's army or the army adding posture as part of their training, which I think it's advisable. Maybe all organizations should maybe in the morning have some training, posture training, so that it will be part of us, because if we are not consistent and we are not doing it, oftentimes we just forget and just go back.
And exactly, like it's not a one way or one time thing that when you come and then you say, oh, be in this position, and then you do it once, you go and you go back to. No, it is repetitive thing that you have to be. You have to be conscious about it so that you do it every day to get used to a correct position or posture of the body.
Very true. And you also made mention it can also increase our height. We'll go for break. When we come back, maybe we talk more on that and dive into the impact of posture and sexual health. All right, we are going for a quick break. When we come back, we shall delve into how posture can increase our height. Yes, short men, this is a secret for you. Hold on, we'll be back. Welcome back from the break, and thank you for sticking with us. If you just joined, this is HealthAfrik on AAU TV, and before the break we were discussing posture, how to position yourself in a good way that is not going to impact on your physical health. And if you didn't hear what Doc said, you can follow the discussion on our social media handles at Association of African Universities on Facebook and YouTube. Hello, Doc. Mr. Samuel, thank you for sticking with us. So before we went for break, you made mention that sometimes good posture also helps to increase height. I'd want you to maybe go into details. How is that possible?
Oh, it's high. Mostly many people or men, really our shoulders, we stand or sit in a slouched posture.
Yeah.
Okay, yes. And this way, and sometimes even the neck is bent forward like this, or sometimes we call it technique. Okay. So if I ask you, if I'm correcting your posture, I ask you to sit where you try to bring your chest out small, retract the shoulders, goes back well, your neck, your chin tuck in, okay, it goes back. See, it has increased my height small.
Yeah.
Okay, then
Compared
going
to,
this
yeah.
way, yes. And with that, you feel confident in your body. Okay, so it increases height, yes. Supposing someone who have had, usually like people with deformity, you talk of kyphosis, okay, or scoliosis deformity, and really they go through surgery for correction. If maybe the person will be measures 1.2 meters or 1.6 or 1.7, after surgery you could see he has gained certain when the curve is corrected, okay, or straightened. Yes, so definitely with a good posture it increases one's height as studies have made us to know.
Oh, right.
Yes.
And so we've looked at posture, its impact on our physical well-being.
Yes.
We've also looked at it in terms of confidence. Now let's look at sexual health.
Okay.
And we know the body is interconnected. Whatever you do may affect another thing,
Yes,
which you may
please.
not know.
Yes.
So with bad posture and compared to men, how does it affect their sexual health?
Oh, thank you very much. I will say that yes, actually posture have connection with our sexual health. Okay. Oh, yes. When we are able to, as initially I've said, that when you stand up well, your posture is good, it actually increases circulation.
Yeah.
Okay, yes. And as you know, it improves digestion also. So circulation, or we see our body, especially for men, we see to be able to have erection. Okay, yes, your penis have to really, it's the blood flow. It's very important. The blood that fills, okay, yes.
Yeah.
So when you stand well with a good posture, well, you have a good circulation, then that effect on your pelvic muscles too, okay, which really will help you with your sexual prowess. Okay, yes. On the other, beside that, we'll also talk about your pelvic posture. The pelvic posture is very important with men who has really anterior pelvic tilting. Okay, if their pelvic tilt anteriorly, it really affects them, and so such men usually have premature ejaculations.
Oh.
Okay. Yes. So it's really posture. When you're talking posture, you might think that it's only how you sit where, and no, it really affects the whole body, the whole body, the system. Okay. Yes. So it really plays a very important role in men's sexual activities.
Right.
Yes,
So if you are saying the pelvic side,
Yes.
if it is
Yes.
interior, that it can lead to
the men will really have a premature ejaculation.
Okay. So at what point can a man know, or how would a man know that okay, so this is due to my bad posture, okay, this is happening due to this bad posture? Or
well, you yourself might not know, because
okay,
if you don't have knowledge of it, okay, so the best thing, if you see that, oh, maybe we are talking about premature ejaculations and things, and you have something like that, it is not only maybe posture, that is not, I'm saying only posture lead you to that. No, there are many other situations or conditions that might lead you. So the best thing is that you seek a medical officer. Okay, you go to a hospital to seek a qualified person to really examine you and know that maybe this might be your problem, and also help you to address for you.
all right. And what tips would you share with our men who would want to perform well in terms of sex? Yeah, maybe some tips, posture.
I will always tell them to always take their posture very important. Yes, as I've mentioned, you see that a good posture or an ideal posture really helps with circulation, really helps actually for our male hormone, the testosterone, really production high, and also it increases your height. So it gives you confidence. And at least if you are not confident, you might not be able to perform or do all these kind of things.
Very,
So it's very important, please.
It's quite scary. I mean, we may not be take into consideration some of the impact of it. These days, there are a lot of, maybe I'm going deeper, but you know, these days there are a lot of sex positions, and people don't know due to this position or due to this posture at that moment. They are only thinking about the adventure and the pleasure and all that, but they don't know sometimes it affects them, even not now, but in future.
Yes, please.
Very soon you may not be performing well, and you will not know it's because of a position you did when you were younger. It's serious. We need to take into consideration our position, our posture, and not just the pleasure and the adventure. Okay, I want to also try because people are doing it.
No.
All right, Doc. Now let's look at the preventive measures, things we should be doing. You've taught us how to sit, how to even holding our phone, standing and all that. Yeah.
Yes, I think common things when you're talking, as in your introduction, you said, men plays important role in the family upbringing. Okay, yes. For them to know that posture, a good posture or an ideal posture really helps child's intelligence. Okay, yes. So if they know that, at least they will help their children to always have a very an ideal posture, because it really improves the child's intelligence.
Wow.
Okay, yes. Yes, studies have shown up that there was a study conducted in the US that they used male students, those who sit well during examination, and they realized that they passed well than you're a parent, and having listened to this important discussion on Father's Day that was Nuffield and AAU is giving to our fathers and all male gender. So you know that, if now I have a child, I will really ensure that take care that my child's posture is really taken good care of. Okay, if there is some deviations, you have got to know you need to bring or take the child to a facility where they can get help. Okay, yes. And also maybe we as father, you might want to perhaps lift all your baby. Okay, maybe if your wife is not around, you want to lift up your baby. How do you go about it if the baby may be sitting on the floor or on the bed? See, when you are bending, you try to avoid bending your back, but you bend down through your hips and your knees, with your back being straight as it is. You don't alter the curvature, the natural curvature of your back. Okay, yes. When you go there, then you lift. And when you lift the baby, you bring it more close to you first before you take it onto your shoulders. Yes.
And then what's maybe simple and easy exercise can we be doing regularly?
Oh, yes, you can. You see, like you need doing we call this simple exercise I can show you. If you are standing or sitting, you can just stretch your arms forward like this. You do isometric arms, and then you bring it this way. Okay, that will help you to actually. And you can, if maybe you've closed from work and you are tired, when you get home, please, your bed, just go and lie facing the bed, okay, vertically. Right, and then your legs will be on the bed. You try to bring your buttocks to the edge of the bed, as if you are sitting on the bed. The edge will be like the seat, okay, and your legs will be on it,
on the bed,
and just your back flat, your arms on your side. You can be in this position for 10 to 15 or 30 minutes. Relax. Okay, that's what, if you do it, you have a very bad posture and you do it often, it will help to correct your posture.
So we do hear of chiropractic and physiotherapy.
Yes.
All these are some measures or some treatments to improve our position and the posture.
Yes.
How effective is this? And what are all these? What's the difference between the physiotherapy and the chiropractic?
Well, they all deal with the body, okay, yes, but then it depends on the training, the way you will handle the body, and the way physical therapists also handle the body, the modalities they will use, okay. So that is a the human body actually is complex, right? One person cannot just deal with. That's why we have different specialties, okay, in the medical field.
Yeah.
Okay, yes. So there are certain things maybe physical therapists will do. There you go to a chiropractor. There's something a chiropractor will do, but the physical therapist will not do.
Okay.
Okay, yes. So that's what I can say.
All
please.
right. Thank you very much for coming and sharing your insight with that in terms of posture. Now, what will be your final words to our fathers listening to us who are now knowledgeable about how posture can also impact on their fatherhood, their sexual health, and also physical health?
Okay, thank you. But then I would like first to wish my father, Joseph Kwame Aboah, happy Father's Day in advance.
Okay.
Yes, he's in Accra here
We
with
should
us.
be watching the camera.
Okay, yes. And I wish all my brothers-in-laws a very happy Father's Day in advance, and all male in Ghana, all fathers in Ghana, I wish them all, everyone a very happy Father's Day in advance. Okay, so in what that we have said, we're coming from Nuffield Clinic. I want to bring sincere greetings from Nuffield Clinic to all fathers, and to wish from Nuffield Clinic, we wish fathers happy Father's Day. We have a very nice package for our fathers this month that as we are celebrating our fathers. So they should all troop into Nuffield Clinic at Osu Sunkwa Street. Okay, if we're coming from Circle, the Ring Road, as if the junction that you branch towards Nuffield Clinic is opposite to the SIC Insurance, the main building. Yes, so it's not a difficult place to find or to locate. Yes, I think then you'll come in more. So I would like all fathers or male in Ghana, whatever you have problem with your posture or your back issue, everything, or please, what I would say that simply come to Nuffield, and we are there to help you.
All right.
Thank you very much for your attention.
Okay, thank you very much, Doctor, Mr. Samuel, and also thanks to Nuffield for accepting our invitation and be here and sharing your insight with us. And we hope to have you again on other episodes. This brings us to the end of today's discussion, where we talked about posture and its impact on fatherhood, sexual health, as well as their physical health. As mentioned, posture is not just about standing fit or rigid, it's also feeling comfortable with your back straight and also projecting confidence. As Mr. Samuel made mention, Nuffield is giving a package to you all this June to celebrate our fathers. Yes, so you can troop in to have a thorough lab checks like prostate, kidney, and many more. And to all fathers who sign up, will have a free therapeutic massage, free vital checks, free doctors and consultation, and many more free packages for you. So take this advantage, or take this opportunity to go to Nuffield for these free packages this June. My name is Isabella Tetahinakwa, and thank you for joining us today on HealthAfrik. See you again in our next episode. Have a good day, and Father's Day to you all.